Vietnam is also one of the very few countries which are now COVID-free. Let's study and learn how our brother from the Far East have emerged victorious from COVID despite limited healthcare budgets. First of all, just like Taiwan, Vietnamese prefer to eat more hot soup vegetables rather than the West fast food, and they follow the rule, let thy food be thy medicine. While Vietnam never had a total national lockdown, it swooped in on emerging clusters. In February, after a handful of cases in Sun Loi, north of Hanoi, more than 10,000 people living in the surrounding area were sealed off. The same would happen to 11,000 people in the Ha Loi commune near the capital, and to the staff and patients of a hospital. No one would be allowed in or out until 2 weeks had passed with no confirmed cases. Even in a one-party state like Vietnam, you need to ensure the public is on board for such a sweeping strategy to work. Dr. Todd Pollack of Harvard's Partnership for Health Advancement in Hanoi, Vietnam says the government did a really good job of communicating to the public why what it was doing was necessary. When the first virus case was confirmed on the 23rd of January, a man who had traveled from Wuhan to visit his son in Ho Chi Minh City, Vietnam's emergency plan was in action. It very quickly acted in ways which seemed to be quite extreme at the time but were subsequently shown to be rather sensible, says Professor Guy Thwaites, director of Oxford University Clinical Research Unit (OUCRU) in Ho Chi Minh City, which works with the government on its infectious disease programs. Vietnam enacted measures other countries would take months to move on, bringing in travel restrictions, closely monitoring and eventually closing the border with China and increasing health checks at borders and other vulnerable places. Schools were closed for the Lunar New Year holiday at the end of January and remained closed until mid-May. A vast and labor-intensive contact tracing operation got underway. Vietnam's response to COVID-19 has been formidable, with reportedly 0 deaths and under 300 cases of COVID-19 nationwide, in a country of nearly 100 million people. To be fair, Vietnam is a one-party state, so naturally there would be doubts and questions about its reporting, but public health experts seem to believe its reporting. With so few cases, and reportedly very few new cases, Vietnam eased its cluster-wide lockdown last week, making it one of the first countries to take this step. Its response is especially impressive, given that it is a lower middle-income country, poorer than neighbors like Indonesia and the Philippines. Those countries face expanding outbreaks and do not seem to have gotten control on domestic transmission. Vietnam has a modest budget for health care and broader public health measures and cannot test as many people as wealthier countries. Vietnam also shares a border with China, where the pandemic originated, and Vietnam's economy is closely linked with that of China. Vietnam also was one of the first countries to have a confirmed COVID-19 case outside of China. How has Vietnam done it? Chastened by its experience with SARS, which hit China, Hong Kong, and Southeast Asia hard in 2003, Hanoi learned from SARS that it had to react quickly to any disease outbreaks and take tough initial measures. Vietnam was the first country to successfully contain SARS. So, with COVID-19, the Vietnamese authorities have reacted immediately, decisively, and with a degree of severity that proved to be a good judgment, albeit one that may not be replicable in freer countries. For one, political leaders have emphasized solidarity in combating COVID-19. Prime Minister Nguyen Xuan Phuc has spoken about the virus as an enemy that the entire nation must unite to fight, talking about COVID-19 like a battle, a war against COVID. Within Vietnam, it has become a matter of patriotism to wash one's hands and stay home, a message that has been successfully communicated through various forms of popular art and propaganda about COVID-19. Vietnam also implemented tough controls on travel and on people who were potentially infected, very early on in the crisis. As other Southeast Asian states dithered, it also was quick to put lockdowns into place. Since the middle of February, Hanoi has been quarantining anyone coming into the country for 14 days, and it stopped Chinese tour groups as well as direct business travel to and from China. It eventually closed all international flights on March 20 after a new wave of infections from European arrivals to Vietnam. Vietnam also has used effective tracing methods using cell phone app from much earlier on in the pandemic than many other countries. It has mobilized huge numbers of people to serve as tracers, making it possible to track down all or nearly all the contacts of infected people and then to track down the contacts of those contacts to ensure the virus did not spread. The fact that Vietnam has a pervasive security state, and can enlist the armed forces, as well as large numbers of civilians makes it easier for Hanoi to do this kind of public health surveillance. Government's competent leadership, and reliance on public health experts to guide it, has been the key factor in Vietnam's success so far, but the pandemic also has triggered a wave of impromptu domestic innovation. A Ho Chi Minh City-based businessperson invented rice ATMs to distribute rice to those in need during the pandemic, while minimizing physical contact. Local hospitals and other scientists have invented affordable rapid testing kits. As it seems to have gotten the virus under control, and is gradually easing social distancing restrictions, Vietnam is already thinking of the life after COVID-19, including scaling up production and export of masks and other forms of personal protective equipment (PPE). Vietnam, in fact, is exporting PPE to developed states. The moment when developed states received COVID-19 tests, masks and other protective equipment made in Vietnam must have struck many who remember the war-torn impoverished country. How much the times have changed. April 30th marks the 45th anniversary of Vietnamese forces' takeover of Ho Chi Minh City, then Saigon. Vietnam emerged from the war, and the period after it, as one of the poorest countries in Asia. Now, it is exporting PPE and offering financial aid to countries like Romania. Crises make or break leadership. COVID-19 could have curtailed Hanoi's foreign policy agenda and undermined its security, but the pandemic thus far has only strengthened Vietnam's international positioning and reputation, and boosted public confidence in the government. Crisis response during the pandemic has probably strengthened the legitimacy of the Vietnamese regime. The next challenges it faces will relate to longer-term economic recovery. Professor Thwaites says the kind of policies applied in Vietnam just wouldn't stand up in countries now suffering widespread infections, but for the few countries yet to be hit, the lesson is there. Prevention is always better than a cure and always cheaper generally, he says.